Dyslipidemia is often explained as a problem of diet, excess calories, or cholesterol intake. Many people immediately think of fatty foods, overeating, or the need for medication. For decades, treatment strategies have focused mainly on dietary restriction and pharmacological therapy. However, this traditional approach overlooks a critical organ that plays a central role in lipid metabolism: skeletal muscle. Skeletal muscle is not just a structure that allows us to move. It is one of the largest metabolic organs in the body. Muscle tissue actively consumes glucose and fatty acids, regulates insulin sensitivity, and influences how lipids circulate in the bloodstream. When muscle mass declines due to aging, inactivity, or prolonged sedentary behavior, lipid metabolism becomes inefficient. As a result, triglycerides increase, LDL cholesterol accumulates, and HDL cholesterol tends to decrease. Resistance training directly addresses this problem by restoring the metabolic function of muscle. Unlike aerobic exercise alone, resistance training stimulates muscle hypertrophy and improves muscle quality. This change has profound effects on lipid profiles. Multiple studies have demonstrated that resistance training can significantly increase HDL cholesterol, the so-called good cholesterol responsible for reverse cholesterol transport. By removing excess cholesterol from arterial walls and transporting it back to the liver, higher HDL levels reduce the risk of atherosclerosis and cardiovascular disease. At the same time, resistance training has been shown to reduce LDL, cholesterol, and triglyceride levels. This effect is not simply due to calorie expenditure during exercise. Instead, it is driven by long-term metabolic adaptations. Muscle contractions enhance fatty acid oxidation, improve hepatic lipid processing, and suppress excessive VLDL production in the liver. These mechanisms work together to normalize lipid balance at a systemic level. Another key mechanism involves excess post-exercise oxygen consumption, often referred to as EPOC. After resistance training, the body remains in a heightened metabolic state for up to 48 to 72 hours. During this recovery period, energy demand remains elevated as muscles repair and rebuild. Fatty acids become a primary fuel source, leading to sustained lipid utilization even when the individual is at rest. This distinguishes resistance training from low-intensity aerobic exercise, where metabolic effects largely end when the activity stops. Insulin sensitivity is another crucial factor, linking resistance training to lipid improvement. Insulin resistance lies at the core of dyslipidemia, type 2 diabetes, and metabolic syndrome. When muscles respond poorly to insulin, glucose remains in the bloodstream and is eventually converted into fat in the liver. Resistance training increases GLUT4 expression in muscle cells, allowing glucose uptake to occur independently of insulin. This reduces blood glucose levels, decreases hepatic fat synthesis, and indirectly improves lipid profiles. Clinical studies have shown that resistance training can improve insulin sensitivity by more than 40% in individuals with metabolic risk factors. These improvements are often accompanied by reductions in triglycerides and increases in HDL cholesterol. In other words, better. Glucose control translates directly into healthier lipid metabolism. Muscle mass also acts as a protective reserve against age-related metabolic decline. After the age of 40, muscle mass naturally decreases by 1 to 2% per year if no countermeasures are taken. This process, known as sarcopenia, accelerates lipid abnormalities and increases cardiovascular risk, even in individuals who are not overweight. Resistance training is one of the few interventions proven to reverse this process, even in older adults. Studies involving participants in their 80s and 90s have demonstrated substantial gains in muscle strength, muscle mass, and improved lipid parameters after structured resistance training programs. Importantly, resistance training is effective not only for obese individuals, but also for those who appear lean yet have hidden metabolic dysfunction. These individuals may have normal body weight, but low muscle mass and high visceral fat. a condition often referred to as thin outside, fat inside. For this population, resistance training is particularly valuable because it increases muscle mass without requiring weight loss, leading to improved lipid profiles and reduced cardiometabolic risk. From a practical standpoint, resistance training does not need to be extreme to be effective. Performing moderate intensity exercises 2 to 3 times per week, focusing on large muscle groups such as the legs, hips, back, and chest is sufficient to induce meaningful metabolic changes. Sets of 10 to 15 repetitions at moderate loads stimulate both muscle and metabolic adaptations while minimizing cardiovascular strain. Consistency matters far more than intensity. When combined with appropriate nutrition, especially adequate protein intake and healthy fats, such as omega-3 fatty acids, the benefits of resistance training are amplified. Muscle becomes more responsive to nutrients. Lipid oxidation increases and chronic inflammation decreases. Over time, this leads to a healthier internal environment that supports vascular health and longevity. Dyslipidemia should not be viewed solely as a problem of blood numbers. It is a reflection of whole-body metabolic imbalance. Resistance training addresses this imbalance at its foundation by restoring muscle function, improving insulin sensitivity, and normalizing lipid metabolism. In this sense, resistance training functions not merely as exercise but as a form of preventive medicine. One squat, one push, one pull may seem insignificant in the moment. Yet over weeks and months, these movements reshape metabolism, protect blood vessels, and reduce disease risk. Muscle activity changes blood chemistry, and blood chemistry shapes long-term health outcomes. By choosing to strengthen muscle, you are actively rewriting your metabolic future. If you found this explanation helpful and want to learn more about the science of movement, metabolism, and performance, please subscribe to the channel and hit the like button. It really helps support the channel and allows us to continue delivering evidence-based content. Thank you for watching.